Hi, everybody. Happy Wednesday. I'm so excited to be here with you for Wellness Wednesday, especially this week as we talk about an equally important topic as the others, supporting the body through a gut autoimmune disorder. So I'll give everybody just a minute to kind of hop on, and I am going to make sure and go to the group so I can see all your questions and make sure I'm live. Hi, Kristen. How are you? Hope it's not too crazy hot where you are. It's crazy hot here. Okay, awesome. We are live. You guys just let me know. If you have any questions, make sure that you post them in the comments so we can all answer your questions while we're here live together. So this is such an important topic. Again, as you guys remember us discussing in the beginning series, the first week, about the prevalence of autoimmune disorders and how we've seen that incidence basically. Hey, Betty, how are you? Hey, Jenny, how are you? Hey, Lisa. How we've seen the Kristen said it's so hot. Yeah, I'm in Georgia. You're in Texas, right, Kristen? I don't know how you're dealing with it because in Georgia, I'm about to freak out. I'm ready to drive north for Labor Day weekend. It's very hot. I've been rubbing peppermint all over me. But you know, the incidence of especially gut autoimmune disorders and what we've seen has gone up almost 400% since the 1950s after World War II. So we're seeing a lot of people suffering from this. And, you know, it used to be years ago before I really started studying wellness that I used to think, yeah, gluten-free, it's kind of like a fad, right? But one of the disorders we're going to talk about tonight, celiac disease, this is a real thing for them. People, this can mean life and death for those people that are suffering from some of these diseases. And so what we're going to talk about tonight, we'll briefly describe some of the main autoimmune disorders that actually affect the gut, and we'll talk about what's happening a little bit. We won't get into that too much because it can get a little bit complicated. And we're going to talk about some of the regimens that I've created for some of the people that I work with on how to support the body naturally through these autoimmune disorders so the body can heal and so the gut can heal. And as the gut heals and these things improve, that's when we start to see the symptoms start to resolve and people's livelihood and their life actually improves. So thank you guys for being here live. All right. So again, we're going to talk tonight about gastrointestinal autoimmune disorders, the top ones being irritable bowel disease. Remember that irritable bowel disease is really like an umbrella diagnosis that encompasses a couple different diseases, one of them being ulcerative colitis, which we'll talk about, and irritable bowel syndrome, which is a little bit different and a little bit less autoimmune than nature, we could say, than ulcerative colitis. We'll talk about Crohn's disease, which is also under that umbrella of irritable bowel disease, and celiac disease. Okay, so let's just make a distinction here so we can understand when someone comes to you, or if you're suffering from this and they say, I have this. A lot of us don't really understand what the differences are, and we need to understand that, right? So let's talk about IBS, irritable bowel syndrome, versus IBD, inflammatory bowel disease, okay? And notice the difference in the terminology there too. So IBS is a syndrome, or really like a group of symptoms. They actually don't categorize it as a disease as such, but it's more like a collection, a myriad of symptoms. Classically, we see chronic stomach pain, discomfort, bouts of diarrhea and constipation, and alternating in between both of those phases. And it's actually really about the nervous system in this process. So you guys have heard us talk about that the gut is actually like our second brain. We have so many different nerves that are stemming from our brain through our nervous systems that are innervating our gut. The gut and the brain are constantly talking to each other. So IBS is really a disturbance in how the brain and the gut interact, and is very much aggravated by stress. It affects mostly women, typically developing in late adolescence or early adult life. Can be triggered by a lot of things, not only emotional and physical stress, but also food, medications, any sort of gas in the bowel and the intestinal tract, and of course, hormonal changes. Again, it does not produce any signs of disease. This is why you see the distinction from IBS to IBD, is because when they do a colonoscopy, which is basically where they take a camera, insert it into the rectum, and go up and look at the colon. And actually will take sometimes a little bitty pinch of tissue from the colon to look at it under a microscope. That's called a biopsy. They don't really see any cellular changes within the bowel wall. It doesn't increase your risk of colon cancer or other diseases of the intestinal tract, the gastrointestinal tract. But it certainly is nonetheless still just as difficult to deal with for some people as irritable bowel disease. But that's really the distinction, is they don't see any cellular changes. Now, IBD, inflammatory bowel disease, is actually, like I said, a collection of diseases, which includes Crohn's and ulcerative colitis. Now, Crohn's is really a disease that actually can affect the deeper layers of the colon and the intestinal tract. Ulcerative colitis is a little bit different than Crohn's because they see ulcerations actually within the gastrointestinal tract, especially in the colon. So when they do that colonoscopy for diagnostic and they take biopsies or they take pictures, what they see in ulcerative colitis is these lesions, these ulcerations. And unfortunately, sometimes people have to have parts of their colon removed because the colon becomes so damaged. So this is a straight up autoimmune disorder. It's caused by an abnormal response. The immune system mistakes healthy gut cells and healthy bacteria in the bowel, and it actually starts attacking them and mounts an immune response against them in order to try and destroy them. It can affect males and females. We do see some genetic correlation here, because when you have a family member that has one of these diseases, as someone in your immediate family, you have a 20 to 30% risk of developing it yourself. It's not associated with any obvious triggers, and it's characterized by these alternating bouts of flares and then remission. So we know that inflammatory process is sort of revving up in some of these people, and then something is causing it to kind of calm down. Again, it causes that inflammation in the bowel, and we definitely see that on colonoscopy and through other diagnostic tests. There's a lot of blood tests that can be done for these types of diseases. These people actually experience anemia, bleeding, weight loss, and sometimes fever. So sometimes there's a real infectious nature to this as well. People can get infections, especially in ulcerative colitis, and you'll see them actually requiring lots of antibiotics, which, as we know, or if you don't know or haven't heard me say this, when you take a round of antibiotics, they kill the healthy gut flora for up to 6 months to a year. It really wipes out the positive gut flora. Okay, so let's talk about celiac disease and how that is different from irritable bowel disease, irritable bowel syndrome. So this is a very specific disease process where the person who is affected actually has a problem processing the gluten protein. And that gluten protein, that comes in wheat, rye, barley, lots of different grains. And unfortunately, you guys, this is where you have to become very discerning, because so much of the food we eat today actually has wheat in it, or wheat products used in them. They're used in sauces. So if you go out to dinner and you have any sort of like thickener, thickened sauce in your food, typically it's wheat. So these people are strictly gluten-free. But what happens in celiac disease is that gluten protein actually triggers the autoimmune response and triggers the body to start attacking the colon. And you can see there in the picture on the right, that's a normal gut, those little hairs. If you want a great description of what healthy gut should be like, go back to my digestive education that I did a few months ago. You can search for that in our user group by just typing in digestion. And I really go into great detail about why those little hairs in the gut are so important. It increases the surface area in the gut, which allows for nutrient absorption. And so in celiac disease, those little hairs are basically not there, or they're more like nubs. And so what you see here a lot of times in celiac disease is really poor nutrient absorption. So they then, what you start to see is, because the gut autoimmune disorder is happening, they start to have systemic effects from that, right? So this is why you see in the picture on the left, they have ulcers and tooth enamel erosion, joint and muscle pain and swelling, stomach pain and swelling, of course, lots of stomach symptoms, right? It can even affect women in their fertility, and lots of bloating, constipation, diarrhea, lots of changes in their skin. So this is where you will see eczema as a manifestation. This is, remember we talked about as eczema, like making sure that the gut is healthy, because a lot of times the skin is a reflection of what's happening in the gut. Lots of time you'll see people with this have hair loss, and they have a lot of nutrient deficiencies. So these people have to strictly avoid gluten and try and allow the gut to heal. Gluten really is life-threatening for people with celiac disease, so very important for them. Okay, so let's talk about different types of causes of these diseases. Remember how we talked about the week before last gut pathogens? So now we're actually finding out a correlation between certain different types of gut pathogens, or what we call gut dysbiosis. And gut dysbiosis is really just an imbalance in the bacteria, the good and the bad bacteria in the gut. And so we're finding, this is why I have started in our practice doing the GI mapping for people, which is a stool test, which helps us tell the different levels of bacteria and the presence of certain bacteria in the gut. And if you have somebody that's interested in that, you can certainly send them to me. But these gut pathogens we're finding out are certain autoimmune triggers for rheumatoid arthritis, for autoimmune gut disease. And so this area of research is really exploding right now. And we're finding that, hey, once we start to balance out, kill the bad pathogens that are causing and triggering autoimmune disease and restore it with good pathogens, all the symptoms go away and the disease virtually disappears. So environmental, industrial societies are the ones that actually see this more often than more rural societies. So when we say environmental, we're really talking about things like chemicals in our environment, pesticides. There's a large hypothesis related to glyphosate Roundup being a large trigger and cause for people with autoimmune gut disorders. So as we see these chemicals that started to be introduced into our environment in the 1950s and 60s, then we start to see this skyrocketing incidence of gut disorders. And again, you'll see people in industrial societies are more prevalent. These diseases are more prevalent in those societies, likely because of the chemical exposure. The industrialization of food. So if you look at the way that we farm now, the way that we get meat from animals, it's all very industrialized. We're feeding them things that are not normal. We're feeding cows corn and soy. They should be eating grass. We are doing high production of food, and we use pesticides, and we also process that food in a very different way, which makes it less nutrient dense. And we've also screwed around with the soil. So when we use these chemicals in the environment, we screw up the soil, the microbiome of the soil. And guess what? If we screw up the microbiome of the soil, the food that we eat, we're screwing up the microbiome of ourselves. So you have seen that with the industrialization of food. The hygiene hypothesis. So the hygiene hypothesis has to do with the fact that we have actually over cleansed our environments. When I used to work in the hospital, we would have these wipes that we would wipe everything down with, and they're essentially toxic to the skin. But we actually are thinking that as people have bleached out their homes and used different chemicals to clean their homes, that we've actually ruined and destroyed a lot of the positive microbiome. I unfortunately had a neighbor a couple weeks ago who was telling me she was doing bleach baths on her children, because they had a skin infection. And this is one of the worst things that you can do to your body, because you're destroying the natural microbiome on the skin. So that's one of the hypotheses. And then family history is a factor here. So there is a genetic correlation. We know that genes can be turned on and off depending on the environment that we put them in, and that some people see a family history of some of these irritable bowel diseases. And then other factors, there are some studies out there that higher incidence of irritable bowel disease, inflammatory bowel disease in people that smoke, higher incidence of inflammatory bowel disease in people that have used oral contraceptives for long periods of time. Of course, diet, we already talked about that. Higher incidence in people that were not breastfed. Higher incidence in people that have been heavily vaccinated, and higher incidence, we know this for sure, in our heavy antibiotic use of our society. We're seeing a lot of problems with these people, especially children that have been on chronic antibiotics for ear infections, strep throat. You're seeing these children with horrible, horrible gut disturbance. And we know there's a connection with autism and the gut, right? So we know that kids that are autistic have really, really difficult gut biomes, and we're finding actually, I love the book Gut and Psychology Syndrome. She really is a great physician who describes this phenomenon, what we're seeing about the degradation of the gut biome through antibiotics and how we're seeing that manifest neurologically in some children. Okay, so now let's talk about how we support the body for autoimmune gut disorders. And a lot of this is evidence-based, as I have gone through some of the research out there, some of the naturopathic research and scientific research on how we supplement and use natural things to kind of support the body. Remember, we're not talking about curative here, right? So this doesn't replace some of the other modern medical things that you may be doing for your disease process. And that is something that you can add on top of this. This is like an adjunct, okay? These are things to support the body to actually heal and try and heal the gut and reduce symptoms, okay? So we know for a fact that the essential oils that are in the Digestin blend, every single one of them you can find a study on about how it supports gut health. So that's peppermint, caraway, coriander, ginger, anise, and fennel are the oils that are in Digestin. Excuse me. And these are wonderful for the gut because they actually help regulate some of the bowel movements, especially if you're suffering from diarrhea. And we know that they help heal the gut. There are multiple studies on this, on these different types of oils in there, especially peppermint. There's a lot of studies on peppermint and irritable bowel syndrome, irritable bowel, inflammatory bowel disease. So we recommend doing Digestin soft gels 1 to 3 with each meal daily. That just kind of supports the gastrointestinal tract with food. You can imagine in some of these, if you're suffering from this, every time you introduce food into the system, it seems to be like an attack on the system, right? Because the gut is already damaged and has a hard time absorbing food and processing food. So we want to support the body in doing that. Lifelong Vitality Pack, you guys have heard me talk a lot about this. It's so, so, so important for people that have any sort of autoimmune gut disorder to be on supplementation because you're already nutrient deprived, and sometimes it takes over supplementation because you have an absorption problem. So in some of these people, you can supplement, but they won't absorb the nutrients because the gut is disturbed. So this is very, very, very important to avoid nutrient deficiencies. The Lifelong Vitality Pack we love because it has all of our vitamins and minerals. It has the cellular repair complex, which is very important because it has the curcumins in that from turmeric. And we have some good evidence on using curcumin to support the body through inflammatory bowel disease. Now, the omegas from the EX Omega are extremely important here. You really want to have a great ratio of omega-6 to omega-3 fatty acids. In our modern day society, because we have such a processed society, related to our food system, we have a typical ratio of 15 to 1. That should not be like that. We should have a 4 to 1 or a 3 to 1 ratio of omega-6 fatty acids to omega-3 fatty acids. And so this supplementation really gives you that, which is great. Now, in the EX Omega, you're getting about 3 to 400 milligrams of both the DHA and the EPA omega fatty acids. We really need more than that in autoimmune gut disorder. We really need need about 1,000 milligrams, sometimes 1,200 milligrams. And this showed improvement in symptoms and healing for some of these people. So you can either do one of two things. This is what I tell people to do. You can double the EX omega dosing. So instead of taking 2 in the morning, 2 in the afternoon, you would take 4 in the morning and 4 in the afternoon. Or another really easy way to do this, and I did this when I was healing from a parasite. Like I took my Lifelong Vitality Pack, and then I actually just took the kids' omega fish oil that doTERRA makes, and I took a teaspoon of that. And that gave me that extra dose of omega fatty acids that I really needed. They are strong anti-inflammatory components for this when the gut is disturbed or when you're dealing with an autoimmune gut disorder, and it really helps support the body. So probiotics are equally as important as omegas through this, through these gut disorders. We really, really need to be restoring the gut with healthy bacteria, and the probiotics are very important. Now, you guys know this if you've heard me talk a lot, that, you know, not every single probiotic is created equally. Most of them are dying in your stomach acid. I'm sorry. So it's very important to have a double encapsulated or encapsulated probiotic. The doTERRA ones are double encapsulated, so you'll see it looks like a pill inside of a pill. It's called PB Assist. And so every capsule has 6 billion CFUs. CFU stands for colony forming units. That's because those are actual bacteria in there. We want them to stay alive as they move through our really acidic stomach acid, okay? We want them to get to the gut and where they work. They help break down our food. They help keep the gut healthy. And they actually help, when we have high enough levels, keep the bad bacteria at bay. So people with irritable bowel disease, inflammatory bowel disease, excuse me, need definitely at least 50 billion CFUs. And you will sometimes see GI physicians putting people with this type of disease on 100 billion colony forming units. And so that's a really, really high dose, probably for flares and situational things. But we try and do at least 50 billion. I've seen some people do 30 billion that don't have severe disease. And so that's actually 3 PB Assist probiotics with each meal. That gets you a little bit over 50 billion. Copaiba soft gels, I recommend 2 daily. The reason why we use copaiba is because it's such a strong anti-inflammatory agent, and it has that that component called beta-caryophyllene. Beta-caryophyllene is actually something that works on our cannabinoid receptors in our body, our CB2 receptors in our body, especially in our gut, and it helps calm inflammation in the body and in the gut. So I recommend 2 of those daily. You can start with 1. And then turmeric essential oil is very important. And I recommend 2 to 4 drops daily in a veggie cap. And remember, this is a daily regimen for a person that we would recommend for supporting the body through these gut disorders. The turmeric essential oil is really important because when you combine that with the curcumin and the turmeric and the omegas, you get 2 different forms of turmeric. So in the LLV, you get the curcumin, excuse me, and the turmeric, you get the turmerones. And the reason that is so important is because when those 2 are combined, you actually get 7 times the bioavailability to the body. This is why I tell people, if you can add raw turmeric root to your food, this is the best way, right? But people are just not going to do that every day because you end up smelling like turmeric. And so this is a great way to get those strong anti-inflammatory aspects of turmeric. And if you can add the turmeric root into your diet, that's great. Very important. But 2 to 4 drops daily in a veggie cap is going to be very, very good for you. And then Terrazyme digestive enzymes, of course. I think this is one of the most important things that a person with a gut disorder can do is supplement with digestive enzymes. All those little beautiful hairs in the gut that we see actually produce enzymes that digest our food. And so when those are damaged or when the gut is unhealthy, then that's when we see undigested food in the stool. And that means the body's not absorbing. So taking Terrazyme digestive enzymes becomes very, very and crucial, so important for people with the gut autoimmune disorder, because we want to get that food really, really broken down so the body can absorb it. So I typically recommend 1 to 3 with each meal. You can kind of play with that dosing and see what works for you. But the most important thing about this digestive enzyme, you must take it before you eat. So think about this. If you take it after you eat, the food is already being digested and sort of moving through the gastrointestinal tract. If you take the digestive enzyme first, you're already kind of prepping the digestive tract with those digestive enzymes to kind of almost coat and prepare the way for the food, right? And then that digestive enzyme works to break down the food itself. Daily 1 drop of peppermint on the tongue prior to the meal and after if necessary. This just really helps resolve some of the symptoms that come along with eating for people with autoimmune disorders in the gut. And so this is a wonderful prophylactic way to kind of also prepare the gut. So that's a daily natural support regimen. For some people that are in severe advancement of their disease, I do recommend DDR Prime, the product that we talked about last week. That helps with cell repair. So that is certainly something, if you're far along in the process or if you know someone that is, that you could recommend that in addition to this daily natural support regimen. So now let's talk about how we support symptoms and how we use some of the natural products that we love to support symptoms. So gas, bloating, obviously this is very uncomfortable. It's debilitating for some people because they feel like they can't go out in public. They can't leave their house. Rosemary, topically diluted on the abdomen, is wonderful for this. 2 drops of ginger essential oil in tea, and 2 drops of peppermint in a veggie cap. And then lavender topically as well with the rosemary. This can do wonders for that. Constipation, until Yarrow Palm came along, I really didn't have a great solution for people with constipation other than mag citrate, which is something you can get over the counter. It's called Natural Calm. It's just magnesium, which helps, the gut motility. But Yarrow Palm is actually an incredible essential oil herb that we can use to help with constipation. Typically produces a bowel movement within 24 hours. And there's no cramping. There's no diarrhea. It's a very natural process. So 2 drops of Yarrow Palm in a veggie cap. Pain, we're going to go back to our pain oils, right? So think lavender, marjoram, frank, extra copaiba, 2 drops in a veggie cap. Start topically. See if you can rub these onto the abdomen first and get relief. We always prefer topical before you move to internal. Poor digestion, if you just feel full, early satiety is what we call it. Like you just eat a little bit and you feel really full. Increase the Terrazyme and also add those 2 drops of peppermint into a veggie cap. So you can certainly take an extra Terrazyme after the meal. Like say you've taken 1 and you just feel really full, like your stomach isn't emptying, then certainly go ahead and take another Terrazyme and take 2 drops of peppermint and a veggie cap. That will help relieve that digestion. We know that the peppermint helps with peristalsis and moving food along in the gut. So it's great for that. Tracy asked a great question. How long before eating should you take the Terrazyme? I typically take it about 10 to 15 minutes before I'm going to eat. I don't wait too long. I don't want to take it like 30 minutes or 45 minutes before, because then the digestive enzymes are moving through the GI tract before my food is there. So I typically, Tracy, just tell people about 10 minutes before you're going to eat. And then certainly it's no big deal if you take it right before you eat. I think that's going to be fine. So great question. Thank you, Tracy, for asking that. So diarrhea, this can be awful, right? Add peppermint and ginger essential oil in tea. Digestin, I recommend actually topically here. And if you're in a pinch or you're out somewhere, if you're a person that suffers from gut autoimmune disorders, you should never not have lemon ginger drops in your purse or your briefcase, because they are life-saving. My daughter had a tummy ache tonight. She's been healing from a parasite the last couple months. And I'm telling you, just 1 lemon ginger drop works for her symptoms every single time as she goes through the healing process. Okay, so let's talk a little bit about food. As we know, herbs and plants can be amazing to support the body through these gut disorders, but food is number one. It's the mainstay of some of the things that we can kind of do to support the body through an autoimmune gut disorder. I have heard people in the past say, yeah, this has nothing to do with food. Obviously, we know for people with celiac disease, that's, gluten is very important for them to not eat. But we actually recommend in all people with autoimmune gut disorders to have complete elimination of gluten. And there are some cross-reactive foods out there, like making sure that it's been prepared in a facility that's a non-gluten facility. Oats can be actually contaminated with gluten sometimes. So you really need to be buying food that's certified gluten-free. There's a couple completely gluten-free restaurants in the city that I live in, so I love that. But you do want complete elimination of gluten, even for people that don't, quote unquote, have celiac disease, because we know that gluten can be inflammatory for people, especially people that are suffering from digestive autoimmune gut disorders. A low FODMAPs diet. If you haven't heard of this, I challenge you to look it up and go check it out. FODMAPs is basically certain types of carbohydrates out there that can be really, really difficult for the gut to digest. And so this is a great way to eliminate those, to let the gut heal for a couple of months. It doesn't necessarily mean you have to do it forever, but it usually helps people heal the gut, and then they can reintroduce those foods. So this is typically certain types of grains, certain types of sugar, certain types of fruits. And if you look it up, I don't want to go into it here because it'll take too much time, but it will explain it. And I also recommend for people with these types of disorders to please have food sensitivity testing. We do one with the Organic South. I do it. It's called a LEAP food sensitivity testing. It's a blood test because people typically have some element of leaky gut syndrome where partially digested food is actually crossing through it into the bloodstream, and it creates basically sensitivities or responses to certain types of food. And while the gut is healing, you definitely want to remove those inflammatory foods. And there's no way to know what's inflammatory for you, may be very different for someone else. Absolutely, please, no refined sugars. This is like putting poison into the body for a person with an autoimmune gut disorder. There's plenty of things you can make, and make it with dates, and make it really healthy and still taste really good and kind of help you with that sugar craving. But refined sugars are absolutely poison for people with autoimmune gut disorders. Limit alcohol intake. I know for some people this is really hard too, so I tell people try and eliminate it for 90 days as the gut is healing, and then you can reintroduce small amounts. But alcohol is just like sugar to the body in these disorders. Please avoid trans fatty acids and high heat refined oils. So these are canola oils, fast foods where they have a lot of trans fatty acids. These are absolutely toxic to people with gut disorders. And of course, processed foods. So try not to eat things out of a box. Try and eat things that are very fresh. Lots of healthy fruits and vegetables, lots of meats that are grass-fed, that are organic. So this is very, very important for people with autoimmune gut disorders. The food situation is huge, and I usually typically right out of the gate with people recommend the low FODMAPs diet because that sort of gets them in the right place, and then they can reintroduce certain types of those carbohydrates later after the gut has healed some. So thank you guys so much for joining us. Not as long as last week, but still a long Wellness Wednesday. So coming up next week, we're going to talk about how to support people through neurological autoimmune disorders, which can be absolutely horrible and debilitating. I used to work neuro ICU many years ago and took care of a lot of these patients. They need a lot of modern medicine help, and they also need a lot of natural support. So I'm excited to talk about that. We'll be talking about Guillain-Barré syndrome, myasthenia gravis, and multiple sclerosis next week, and how to support people through these disease processes with their symptoms and to naturally support the body. So thank you guys so much for joining. I hope you got a lot of great information. If you have any questions, please leave them in the comments and I will be happy to answer them. You guys have a great Wednesday night.